All right, so today's question, we're here with Dr. Serrano, is many people are wondering about the relationship between growth hormone and cancer. Do people take growth hormone, do they get cancer? So that's the question for Dr. Serrano today.
Okay, I gotta do this question as a scientist, as a physician. As a physician, I see a lot of people in my office that they're using growth hormone prescribed by somebody else, so they're using it because they want to be younger, anti-aging purposes, and also, increase the growth hormone levels. Now, I do want to add that the scientific literature do say that cancer cells, especially prostate, breast cancer, have shown to have insulin growth factor receptors that actually make that cancer cell behave more like a cancer cell, not even when it was cancer, but it starts acting up like a cancer cell. In vitro, if you put insulin growth factor in there, the cancer cell will start multiplying much faster. So they do some kind of reaction. Now, I want people to understand that growth hormone is not the cancer cause of that cell to do that. I think it's a secondary part of it. Now, I want people to understand, because people just think, oh, I use growth hormone and then that makes me bigger. Well, growth hormone injected, okay, and it goes into insulin growth factor 1, and yes, and we have insulin growth factor 2. People are not aware of that. Now, when we also do that, the liver also makes, to protect us, insulin growth factor binding protein 1 to protein 6, okay? Now, we think that there are about 10, 15 of those. We only know 6 right now that we can identify them. Now, the problem is that people don't understand is that we only think about, we only think about the drug, Now, you have the keys, but those keys have to go into a receptor. And when you have the receptor that is working well, that key, okay, binds to that receptor, to that rock, pretty easily. But now, we know for sure by scientific literature that the insulin growth factor 2 receptor mutates, okay? And that actually can cause that cancer cell to grow or develop or multiply, okay? Now, is it that the insulin growth factor 1 and insulin growth factor 2 is binding to it? No. Is that even the insulin growth factor binding protein can bind to that receptor and activate that receptor. So in the future, I think they're going to have a test that you can measure that receptor, and you'll be able to say, hey, I have a higher tendency, or I have a risk factor that I can possibly, if I take growth hormone, I can get cancer. Now, in medicine, I have not seen, in the last 27 years, I've never seen growth hormone inducing a cancer, or seeing a patient here, oh, I took growth hormone and I have cancer now. Now, of course, the population that we're doing this with are the people in the 40s and 50s that want to be anti-aging. And the key also is when those people are taking growth hormone, now they want to eat better, they want to exercise. So they're reducing all the risk factors that would have been causing cancer. Now they're changing it because they're feeling better.
Okay, so one more question.
Yes, sir.
I also get asked from people about Increlex and IGF-1, just straight IGF-1. Okay. Can you talk a little bit about...
First of all, I will never ever use that. It does help you get leaner, because I've seen it. If people come leaner, they say, I don't hold water, I'm leaner. One side effect that I see of that, actually, people do say that they get more full, okay? Now, the only problem is, if I inject the insulin growth factor, okay, now I'm bypassing my liver, and I'm not making those insulin growth factor binding proteins that protect you. I'll be very careful. The price is very high. I will stay away from it, not because it doesn't work, it's because I'm concerned about your health first. So stick with growth hormone. Until it's proven that it works better, I will not do it.
Okay, thank you.
Thank you.